Hello, Janet. So nice to have you working at Interior Health with us.
Excited to join the team.
Today we are going to focus on the handling and management of controlled substances in Interior Health. As you may be aware, the requirements for handling of controlled substances are set by the federal government through the Controlled Drugs and Substances Act.
Yes, I believe Interior Health has a controlled substance policy that reflects these legal requirements.
That's right, Janet. And recently, our internal audit team conducted an audit to determine if adequate controls are in place. The diversion of controlled substances poses significant risk to patient safety and to staff well-being. Several recommendations came forward from the audit. As a result, the Controlled Substances Policy has been further revised to ensure we are doing our best to mitigate any diversion risk.
Yes, I'll make sure I carefully read the policy.
Excellent. And today we'll highlight the revisions to the policy. Here we have a patient that has just been transferred to the unit who is receiving a time-dependent controlled substance. Examples include a fentanyl patch, or a continuous controlled substance infusion, which requires a lockbox. PCA and epidural infusion pumps also have designated lockboxes. For controlled substance patches, both the sending and receiving nurse must document the date, time, name of the patch, strength, location, and nurse initials. For controlled substance infusions, both the sending and receiving nurse need to document the date, time, name of medication, remaining volume in milliliters, and nurse initials. When the full contents of any dosage of a controlled substance is removed from an automated dispensing cabinet or ward stock and not used, the clinician preparing the controlled substance must be the one to waste the unused portion. This should occur at the time of preparation and requires a witness.
So 2 licensed healthcare professionals must witness and sign for any and all wasting of controlled substances?
With a few exceptions outlined in the policy, yes, this is the case. This includes disposal of used or opened controlled substance patches. Never leave controlled substances unattended. They should never be left in delivery bins, carts, or on countertops. They must be kept in a secure storage device. Our nursing managers conduct audits for select patients who receive controlled substances. As nurses, we need to ensure that we are handling controlled substances safely. Not wasting remaining amounts of controlled substances immediately is prohibited, except for patient care areas that have been authorized to use patient-specific lockboxes to store controlled substances that are being titrated to effect. These care areas include emergency departments, labor and delivery, critical care units, operating rooms, and post-anesthetic care units. Lockboxes must be permanently secured and only contain medication for one patient at a time. They must not be used for routine storage of any other medications. Sites must have a procedure to ensure lockboxes are emptied at the end of each shift or when a patient is discharged or transferred to another level of care. This wasting requires a witness. The codes for lockboxes are changed at least annually. Here, a nurse has discovered a discrepancy which should be reconciled before the end of her shift.
What would happen if the discrepancy can't be resolved?
Discrepancy reports are printed to the unit twice daily. If the discrepancy is related to loss or a theft of controlled substances, the person who discovered the loss or diversion, as well as the department manager, are responsible for documenting and immediately reporting any unresolved discrepancies in the Patient Safety Learning System using the narcotic count icon. They must also complete Health Canada's loss or theft report form and forward it to the pharmacy lead at their site. The pharmacy PPL or designate must then email the loss or theft report form to Health Canada and the College of Pharmacists of BC within 10 days of the reported loss or theft. Logbooks are a legal record for controlled substances not stocked in the automated dispensing cabinet and are issued from pharmacy. New entries into the logbook and shift counts will be done in red ink.
When do you return a logbook to the pharmacy? Once it's full?
Even if it's not full, the logbook must be returned within 12 months of issue and a new logbook is requested. It also needs to be returned when there is a change of nurse manager responsible for the unit or whenever the logbook is full. The logbook goes to the nurse manager for audit to ensure there are no outstanding discrepancies prior to being returned to pharmacy for safekeeping. Sometimes patients urgently require a medication but they do not yet have a registration account, which means you cannot look up their name in the automated dispensing cabinet. Nursing then has the option to create a temporary patient profile. If the patient's identity is known, the nurse can use their name and a second identifier to create the temporary profile. Sometimes the patient's identity is unknown, so nursing will need to create a profile for an unknown patient and note the location. When unknown patient profiles are created, the nurse must contact pharmacy with a true identity once known. This allows pharmacy to reconcile the medications to the correct patient. For controlled substances, this is a Health Canada requirement. Pharmacy will merge temporary patients created by nursing on the automated dispensing cabinet with the patient's registered profile daily. Any temporary patients created that cannot be matched to a registered profile will be brought to the attention of the responsible nurse manager on a weekly basis for investigation. Let's summarize what we've covered. Accurate and thorough documentation is required when handling controlled substances. With some exceptions, controlled substance waste requires a witness. Patient-specific lockboxes can only be used in ICU, emergency labor and delivery, operating rooms, and the post-anesthetic care unit. Discrepancies must be resolved prior to the end of the shift in which they were discovered. Logbooks will be issued from pharmacy and must be used to account for all controlled substances stored outside of an automated dispensing cabinet. When a temporary patient profile is created in the automated dispensing cabinet, the nurse must contact pharmacy once the identity of the patient is known, so pharmacy can merge the two patient profiles.
Wow, I have a lot to learn.
Yes, indeed, Janet. And there is more to the policy than we have had a chance to cover in this orientation.
I'll ensure I review the controlled substances policy and understand my responsibilities in meeting these requirements.
Thank you, Janet. Your commitment to keeping our staff and patients safe by following proper procedure is greatly appreciated. If you have any questions regarding this policy, please contact your local nurse educator. If you have concerns or questions around general practice or concerns about the handling and management of controlled substances, please see your manager.